Let's discuss essentially a dose-response relationship between altitude and your physiological function as it relates to exercise. So I'm going to be giving some thresholds here so we can all kind of talk about the same thing and have similar definitions. So at sea level, we'll say that's anything less than 500 meters or 1,640 feet. So I'll just list the meters going forward. So at sea level, no effect of the altitude on physiological function at rest or exercise. This is our baseline control situation. At low levels of altitude, so we'll call this 500 to 2,000 meters of elevation, you're going to have minor performance decrements, and this is mostly going to be something that you can overcome with acclimation to that level of altitude. So you should be able to fully achieve your sea level performance at this level of altitude if you acclimate entirely. At moderate levels of altitude, so we'll call this 2,000 to 3,000 meters, there are now going to be some effects when you're resting. So just kind of going about normal daily activities is really what we mean here. All right, so there's going to be a moderate decrease in your exercise performance, and you're going to be able to get back most of that exercise performance with acclimation to the altitude. Although you might not get it all back, but you should be able to get most of it back. At high levels of altitude, so we'll call this 3,000 to 5,500 meters, now is when you're going to start to see things like acute mountain sickness. You're going to have large decreases in exercise performance, and your acclimation after weeks of being at altitude is only going to do so much. You're still going to be exercising and performing at a lower level than what you could at sea level. And then extreme altitudes, we'll call that anything over 5,500 meters. So we're talking about high mountains like Mount Everest. In those situations, severe hypoxic effects, definitely the chance of deadly effects and severe decreases in performance should be expected. For this series of videos I'm making on altitude, let's just define altitude, if I just say altitude, as anything that is greater than 1,500 meters. So essentially gets us into this high-low range, or into the moderate range, close to that moderate range at least. All right, so we should be seeing some effects on exercise, maybe not so much rest, but some effects on exercise once we hit that threshold, which is the primary purpose of these videos here, is to talk about what's happening during exercise when you're exercising at altitude. Generally, when you're hearing about altitude, when it's discussed with exercise or athletic performance, you hear a lot about oxygen and how there's a lack of oxygen at high altitudes. Let's talk about exactly what people are meaning when they say that. So we have to start by talking about atmospheric pressure or barometric pressure, because that's what drives this. All right, so atmospheric pressure or barometric pressure at the location where you are is determined by how much air is above your head. So it's the full column of air above your head all the way to outer space, essentially. So at sea level, that's about 24 miles of air pushing down on you. So when you're at altitudes, there's less air above your head because you're higher up and closer to outer space. And so it's less than 24 miles, meaning you're going to have less atmospheric or barometric pressure because of that. All right, so when you are at these elevated locations, the percentage of oxygen, carbon dioxide, or nitrogen does not change compared to what it was at sea level. So for instance, oxygen is always going to be around 20.9% of the atmosphere, no matter where you are. What does change is a decrease in the partial pressure of these gases. All right, so this is going to be going down as the atmospheric pressure goes down. So let's explain exactly what I mean by partial pressure for a second. So let's look at this diagram over here. We have this simplistic diagram of lungs. So the left lung, we'll say, is at sea level. The barometric pressure is about 760 millimeters of mercury. And again, 20.9, so about 21% oxygen in the atmosphere. The right lung, we'll say, is at Mexico City. So that's an elevation of about 2,200 meters. So the atmospheric pressure there is going to be about 585 millimeters of mercury. Still 20.9% oxygen though. So again, both of these are 20.9% oxygen. But when you take 760 and take 20.9% of that, you get 159 millimeters of mercury of partial pressure of oxygen. This is the pressure that the oxygen is applying essentially to the walls of your alveolar sacs, pushing the oxygen into your bloodstream. So you want higher atmospheric, or you want higher partial pressure of oxygen pushing the oxygen into your blood. So again, at sea level, it was 159 millimeters of mercury. Now in Mexico City, it's only 122. That means less pressure pushing that oxygen into your bloodstream, oxygenating your red blood cells and your hemoglobin. So you're not going to get as much oxygen flowing around your body. When you are in a situation where you have substantially less oxygen floating around your blood than normal, we call that hypoxia. All right, so less oxygen in your blood. This can occur at high altitudes, especially high altitudes when you're exercising intensely. So when you have normal amounts of oxygen in your blood, that's what we call normoxia. So that's what most of us are experiencing at sea level. All right, so when we go up to altitude, just quickly go over what happens with exercise performance. Short anaerobic performance is really not going to be affected. So this is single bout anaerobic type performance. It's not limited by the amount of oxygen you can get out to your muscles. And so it's not going to affect these sports negatively. Where it does affect it is long aerobic endurance-based performance at altitude. So this is going to have a dramatic decrease in your aerobic performance or your endurance performance. This is going to be because, once again, the oxygen getting to your blood and then eventually to your muscles is really important for these types of activities, and that's exactly what all of this is making harder. Let's look at this diagram here to understand exactly how much of an impact altitude is going to have on that partial pressure of oxygen in your in the atmosphere, which is again is what pushes the oxygen into your bloodstream. All right, so on the x-axis here we have elevation starting at sea level and going up to 10,000 meters, which is really, really high, higher than the highest mountain on Earth. And on the y-axis we have a few different things here. We have the atmospheric pressure. This PB is the atmospheric pressure, or barometric pressure really. So at sea level it's 760. That's where we're seeing here, and then we're seeing it going down as elevation goes up, which is why this line goes in this direction. All right, we also have here, so it's again barometric pressure or atmospheric pressure multiplied by 0.209, which is 20.9%, which is how much of that is oxygen. And that gives us the partial pressure of oxygen at the various locations. So essentially where I am here is near New York City. It's a large city in the US that is at sea level. So 760 millimeters of mercury of barometric and atmospheric pressure, 20.9% of that is 159 millimeters of mercury of partial pressure of oxygen. If we go up to the highest city in the US, that's Santa Fe, and that's going to be a little over 2,000 meters or a little over 6,500 feet, and that is going to bring us over here to about 125 for the partial pressure of oxygen. Again, 20.9% of total pressure, which is about 600 here. If we go out to the highest large city in the world, this is in Bolivia. This is going to be a little over 4,000 meters. This is going to give us, say, about 90 or so for the partial pressure of oxygen. So that's dramatically less than what you saw at sea level of 159. If we go to the largest permanent settlement, that's a little bit higher yet, so a little over 5,000 meters or so it looks like here, and that's going to give us around 85 for the partial pressure of oxygen. If we go out to Mount Everest, which is the tallest mountain on the Earth, then we're talking about, say, I don't know, maybe 9,000 meters, just eyeballing this graph here, and that gives us a partial pressure of oxygen of maybe around 50 or so. So dramatically less than all the other ones I've said so far. Again, as altitude goes up, the barometric pressure and the partial pressure of oxygen are going to go down in a sort of somewhat linear fashion. In this video, I went over just really briefly what happens physiologically, especially with exercise, but we need to go into a little more detail. I'm going to make another video that I will link to below on this, and I hope you'll come see that too, because I think it's important to understand this concept. Generally, when we talk about exercise and altitude, we talk a lot about oxygen and the inability to get the oxygen out to our muscles. But there are also some fundamental things that are changing with your metabolism, regardless of the oxygen itself, or the ability to get that oxygen to the muscles. So looking at the metabolic response to altitude exposure, you're going to see an increase in your basal metabolic rate or your resting metabolic rate. This is going to be because you're going to have an increase of thyroxine secretion and catecholamine secretion. So thyroxine is a thyroid hormone. You can see the image of the thyroid right here as this skeleton rotates. Catecholamines, we're talking about your sympathetic neurotransmitters and getting into the bloodstream, sympathetic activity, norepinephrine, epinephrine. These things are going to increase your metabolism, and it's going to require you to eat more food in order to maintain your body mass, or you're going to end up losing weight unintentionally. As this is occurring, you're going to get a greater reliance on glucose as a fuel compared to fat, which is generally not something you really want for exercise performance because we're much more limited on glucose than we are on fat in our bodies. So this is going to mean that initially the anaerobic metabolism, which is what is driving at least some of the ATP production from glucose, is going to be elevated. You're going to get an increase in lactate production and probably an increase in lactate showing up in the bloodstream during exercise. After you've acclimated to the altitude, that lactate production is going to decrease somewhat. It probably won't go all the way down to where it was at sea level during the same exercise intensity, but it should go down compared to what it was when you first got to altitude. And this is going to be largely because we're going to have a slightly lower sympathetic drive after you've acclimated than what you experienced when you first went to altitude. So when you first go to altitude, you get a really strong sympathetic drive. So a lot of these changes with your metabolism are going to be driven by hormones and other things floating around in your bloodstream. But let's talk in another video about some things that are going to be changing about the blood itself. There are going to be a number of changes that happen in your bloodstream as you go up to altitude and eventually as you adapt to that altitude. That's what we're going to be discussing here. So one of the first things that happens when you go up to altitude is you're going to have a decrease in your plasma volume. This is the fluid portion of your blood, so essentially the water within your blood. This is going to begin within hours of arriving at altitude and is going to continue over several days to potentially weeks depending on the level of altitude that you're at. And this is essentially you dehydrating. So you're going to have either normal to high levels of respiratory fluid loss. So as you breathe in and out, the air that you're breathing in is dry, the air you're breathing out is fully humidified. So you're losing a lot of water that way. You're also going to have an increase of urine production, and all this is not going to be replaced as it normally would, leading to that reduction in plasma volume. So you can lose up to 25% of your plasma volume, again, those first days to weeks. This is a short-term adjustment that your body does, and the benefit to it is that it's going to concentrate your remaining red blood cells, which concentrates the hemoglobin within those red blood cells in your blood. So it means per unit of blood, you're getting more red blood cells, more hemoglobin out to the body. Not always such a great thing, but it can at least increase the oxygen concentration within your blood because it's concentrating those carrying hormones, those carrying proteins. Over time, though, this should return back to normal or near normal as you're over an additional few weeks or so, because your plasma volume will return eventually. The other big change that's happening is going to be with the red blood cells, which is what makes up most of the remainder of your blood. Right, so within about 3 hours of going to altitude, a high altitude, enough to trigger some form of hypoxia, even mild hypoxia, your kidneys are going to sense this, and they're going to start to secrete erythropoietin, which is EPO. This is the hormone that stimulates the bone marrow to start producing and releasing red blood cells into the bloodstream, and you're going to get an increase in red blood cells in the bloodstream within about 2 weeks. All right, small increase, but you'll get an increase by about 2 weeks. And then you'll have an increase in hemoglobin concentration, which is in the red blood cells that is measurable within sort of a weeks to months. So it takes a little longer for those red blood cells to build up enough to basically sense that increase in hemoglobin. All right, so what's going to happen again is you're going to get a decrease in plasma volume initially. You're going to get over time an increase in red blood cells, and then the plasma volume will return. In another video, I'm going to start getting into exactly what's going to be changing with your cardiorespiratory system when you exercise at altitude versus what it was at sea level. And we'll talk about the various components of that. Exactly how your cardiorespiratory system is going to respond to exercising at altitude is going to vary a little bit based on how long you've been there. And we also need to separate out submaximal versus maximal exercise because there are some differences there. So here, let's talk about the first 6 to 10 days, and then after 6 to 10 days when you get a little bit of acclimation. And we're specifically here talking about submaximal exercise. And really what's unique about submaximal versus maximal exercise, or what's different about them, is at submaximal exercise levels, you can compensate with different physiological functions. So some things can increase in order to compensate for what other physiological functions are not doing as well. At maximal exercise, everything's working at their physiological ceiling. They can't go any harder, faster, or higher, and so there's no compensation that can happen. All right, so first 6 to 10 days, submaximal exercise. You're going to get an increase in your cardiac output at a matched submaximal exercise level. This is going to be driven by a dramatically increased heart rate. So if you look at the graph over here, we have heartbeats per minute on the y-axis, and we have exercise intensity as a percentage of maximal sea level ability on the x-axis. We have a sea level line, and we have a higher altitude line, and you can see that at every exercise intensity the higher altitude line has a higher heart rate. Okay, so again, dramatically higher heart rates with submaximal exercise at altitude. This is going to be combined though with a decrease in stroke volume at this same exercise intensity. All right, so what exactly is going on? The greater cardiac output is going to be something that we need in order to compensate for the lower oxygen concentration within the bloodstream because you're at altitude. This is the primary problem with exercise at altitude. Your stroke volume is going to be lower because your plasma volume is decreased. Right? So we've talked about this in a previous video. You can see the links below to find that. Plasma volume is going to decrease when you go up to altitude, especially initially, and it's going to help to concentrate those red blood cells and hemoglobin, but it's still going to have a negative effect on stroke volume. The dramatically increased heart rate, though, which is going to drive that increase in cardiac output, is going to be because we have a large increase in sympathetic activity, which is what generally raises heart rates. So this is going to be a short-term adaptation that we do, this dramatic increase in sympathetic activity and heart rate in order to raise that cardiac output, because it's not something our body really wants to do because it's going to decrease exercise efficiency, especially of the heart itself. After 6 to 10 days, we're going to get a slight increase in the AVO2 difference, so the arterial venous oxygen difference. So this is how much oxygen we're extracting out of the blood. So in other words, we get an increase in oxygen extraction from the blood, and this is going to decrease the demand on that cardiac output, which allows sympathetic activity to go down a little bit, allowing heart rate to go down a little bit, and cardiac output to go down a little bit. It still probably won't go down as much as what it was at sea level unless you're at very low levels of altitude, but it's going to approach that. All right, let's talk now about what's happening with your pulmonary ventilation, so how much you're breathing in and out during submaximal exercise at altitude. So what we're seeing on this graph over here is oxygen consumption on the x-axis, so essentially exercise intensity, aerobic exercise intensity going up. And we have pulmonary ventilation on the y-axis. So as exercise intensity goes up, so does your ventilation. So this is your sea level line, but this is your altitude line. So this is about a little under 6,000 meters of altitude. So much greater increase in ventilation at every exercise intensity level at altitude compared to sea level. All right, this is going to be a compensatory mechanism. Remember, we can compensate submaximally. We cannot compensate with maximal exercise. This is going to be a compensatory mechanism because of the lower number of oxygen molecules per volume of air. We have the same percentage of oxygen, so it's still about 21% oxygen in the air around us, but the density of the gas molecules in the air, including the oxygen, is just going to be less, so they're going to be more spread out. So per volume, so per filled lung volume, essentially, you're getting less oxygen in your lungs. All right, this video is all about what's happening with submaximal exercise. I'm going to have another video I'll link to below on what happens with maximal exercise. So remember, you cannot compensate during maximal exercise the way you can with submaximal exercise. So things are going to be a little bit different. When exercising at a maximal aerobic ability, so as hard as you can, whether it's getting on a treadmill, going as fast as you can, or like a hard aerobic endurance-based exercise performance, like a race or something like that, there are going to be a lot of things that are not going to function as well at altitude as what they would have at sea level. So let's talk about some of those things as it relates to the cardiorespiratory system. We're going to separate this for the first 6 to 10 days on this slide, and then on the next slide we'll talk about what happens after 6 to 10 days when some acclimation has occurred. All right, so before any acclimation has occurred, so you first get to altitude, you're going to have a decrease in your cardiac output at maximal exercise intensities. Again, the key here is with maximal exercise, you cannot compensate, so things are at their ceiling, and the ceiling is going to be lower. So you're going to have less cardiac output at maximal exercise. This is going to be driven both by a decrease in maximum stroke volume and a decrease in maximum heart rates. The stroke volume is going to be decreased at maximal exercise because we have less plasma volume, so we can get less blood in and out of your heart per beat. And the heart rate at maximal exercise is going to be a little bit suppressed because the heart becomes less responsive to sympathetic activity. When you go up to altitude, sympathetic activity goes up and your heart starts to desensitize to that pretty quickly. And so once you get to maximal exercise intensity where sympathetic activity is really pushing hard and driving hard, and normally your heart rate would go very high, it's just going to be a little less responsive to that because it's been experiencing that all day long for however many days you've been at altitude. So lower cardiac responsiveness to that sympathetic drive, lowering that heart rate, lower stroke volume, lower heart rate means lower cardiac output at maximal exercise. Let's look at what's down here now. So your VO2 max, which is the amount of oxygen you can consume, which is essentially your aerobic fitness or aerobic ability, is going to be dramatically decreased at altitude. This is going to be because we have less AVO2 difference, so arterial venous oxygen difference, so less oxygen extraction, dramatically less so, and decreased cardiac output max. The AVO2 difference is going to be decreased because we have a lower partial pressure of oxygen gradients between the blood and the air within the lungs. Right, so the air that comes into your lungs is going to be less dense, so you get less partial pressure of oxygen pushing that oxygen into the bloodstream, and so you're going to get less oxygen floating around your blood, which means you can extract less oxygen from that blood once it gets to the muscle. The cardiac output is going to be lower for all the reasons we mentioned up here, so we've already covered that. After the first 6 to 10 days, when some acclimation has occurred, the effects on your VO2 max is going to be a little less so. It's still going to be a negative effect. You're still going to be having a harder time with exercise and having lower exercise performance. And the primary driver is going to be that decreased AVO2 difference max, or that decreased oxygen extraction from the lower partial pressure of oxygen driving the oxygen into the blood and getting out to the muscle. Also still going to have some effect of the cardiac output. This is, though, going to be a little bit different depending on how high the altitude is. So at sort of lower to moderately high altitudes, the primary factor is going to be that lower amount of oxygen on the hemoglobin, leading to that less AVO2 difference, the lower AVO2 difference. Cardiac output is going to be suppressed, but not nearly as impactful as the AVO2 difference. Once you start going above 4,000 meters into some really high altitude environments, think very high mountains like Mount Everest, Now you're going to have all those effects of your hemoglobin having less oxygen attached to it, leading to lower AVO2 difference, and it is going to get worse as the altitude goes up. It's going to continue getting worse, but the effects on cardiac output start to be more and more noticeable. So you're going to get greater decrements in cardiac output, more so than what you had before 4,000 meters. We're really focused here on exercise performance at altitude, but if you're at a high enough level of altitude, you can also start getting some negative effects at rest, and also some pretty serious side effects that can be deadly. We're going to be talking about that in another video where we talk about altitude or mountain sickness. Altitude can have effects on more than just exercise performance and training performance. It can also have effects on your health and make you sick and potentially even be deadly. One way it's going to do this is with something called altitude sickness or mountain sickness. This is going to typically have onset within 6 to 48 hours of getting to altitude, so your arrival or ascent to altitude, and it will be most severe around 2 to 3 days after arriving at altitude. So after that, your body will adapt a little bit and the symptoms will likely diminish, or you've gone to sea level, hopefully, and to get rid of the worst effects. So some of those symptoms are headache, nausea, vomiting, shortness of breath, insomnia. Altitude sickness does have two deadly forms. We have HAPE and we have HACE. HAPE is high altitude pulmonary edema. HACE is high altitude cerebral edema. So we're talking about essentially fluid collection either in our lungs or on our brain. Both of these are deadly. So these are things that if someone's experiencing that, the only real treatment is to get them back down to sea level. With high altitude sickness or mountain sickness, the incidence, so the likelihood of you having this occur to you, is going to be greater with higher levels of altitude, especially above 3,600 meters. It's also going to be higher with a greater rate of ascent. So in other words, the faster you climb that mountain, the more likely you're going to get altitude sickness, because you haven't given your body time to adjust to the different levels of altitude as you go. One possible cause of mountain sickness is going to be a low ventilatory response to that altitude. So in other words, you go up to altitude and where you should be breathing more frequently and also deeper, your body probably does do that, but just not as much as it should. And that's going to cause CO2 to accumulate within your body and in your bloodstream specifically, leading to an acidic bloodstream or acidosis, and could cause a lot of these symptoms that we just discussed here, and again be life-threatening. Despite these potential dangers of altitude, they are fairly rare unless you're going to really high levels, but a lot of people use altitude as a tool in order to increase their endurance performance, and we're going to be talking about that in another video. If you are exposed to altitude for a prolonged period of time, some acclimation should be expected, and this can potentially lead to actually improvements in endurance performance. So let's talk about that here. So what exactly is altitude acclimation? It's an increase in the performance at altitude because you've been there for a long period of time, so a chronic exposure. So in other words, your performance at that level, so at that altitude level, will approach what it was at sea level. Probably won't reach what it was at sea level, but it'll approach sea level. And then potentially when you go back down to sea level, you could even have elevated performance depending on the situation. And there is some debate to that, which we'll get into. To give some numbers here, with moderate levels of altitude, which is about 2,000 to 3,000 meters, it takes about 3 weeks to acclimate. And for every 600 meters above that, it's about another week to acclimate to that new level of altitude. Your performance, again, will probably never be what it was at sea level, but it will get better. This is especially true once you get to higher altitudes, like above 3,000 meters. These effects of the altitude acclimation will stay after you go to sea level, but they will only stay for a short period of time, about 1 month after returning to sea level. So it's not a permanent effect. Given these potentials for altitude exposure to improve your cardiorespiratory system to handle exercise, and how they do remain for at least a short period when you go to sea level, a lot of people try to use this to improve their endurance performance for athletics. All right, so let's talk about this here. red blood cell concentration in the blood or number in the blood will go up after you've acclimated. This is going to increase your hemoglobin concentration so that you can have more oxygen carrying capacity per unit of blood. This is going to help to counter that effect of the lower partial pressure of oxygen, so the lower oxygen gradient essentially pushing into your blood from your lungs into your blood. So that is all a good thing. This is the main thing people are trying to achieve when they use altitude as a training tool. Some other things that are happening though. You're going to likely get a decrease in muscle metabolic capacity. All right, so this seems counterintuitive here, but when you stop and actually think about training at altitude, it will make sense. When you are training at altitude, because it is more difficult, if you are training intensely, like most athletes who are going to go out of their way to experience altitude are, you're going to actually have a decrease in your training performance, which is going to have an effect on your ability to exercise, right? If you lower your training performance, you're going to lower your fitness level over time. All right, and that's what's going to lead to this decrease in metabolic capacity. So you're going to have a decrease in mitochondrial function and glycolytic enzymes. You're going to have a decrease in oxidative capacity as well. So across the board, decrease in metabolic ability, essentially. You're also going to have some issues with muscle function and structure. So a decrease in the cross-sectional area of your muscle. In other words, that muscle is going to atrophy and likely get weaker because of that. Because it is the muscle fibers themselves that are shrinking and you're not necessarily losing capillaries, you're going to end up getting an increase in capillary density because you're having less muscle fiber in a unit of tissue. And you're going to have a decrease in muscle mass, again, going along with this decrease in cross-sectional area due to protein wasting, so muscle wasting that's likely to be something you experience when you're at altitude for a while. Right, so living and training at altitude versus just living at altitude, what is the difference? Which one is more ideal? All right, so living and training at altitude has all the negative consequences that I just mentioned here, while having also these positive ones I mentioned up here. So decreased training intensity, decreased training volume, because the altitude training is more difficult, leading to a decreased fitness level overall. And this is the reason why most people aren't really recommending altitude training these days. However, you still can take advantage of altitude. So you can do this either by living at altitude and traveling down to sea level to train so you don't have those negative effects on your training, or going to a location like this where it's a simulated high altitude environment. This is used for training. Again, I wouldn't recommend this typically for training, but you could just spend your day in an environment like this or sleep in like a low oxygen tent or a low oxygen apartment, something like that, in order to have this effect. So live high, train low. This is the only scheme that for using altitude to benefit your endurance performance that has shown reliable improvements in training and exercise and athletic performance, endurance performance specifically. So again, living high and training high, potentially not so great. Living high but training low, so down at sea level, is much better because you don't have those negative effects on your training. We've talked a lot in this video as well as in this video series about how high altitude environments lead to lower oxygen partial pressure, and that decreases how much the oxygen is being pushed in your blood, decreasing the oxygen levels floating around your bloodstream, and that's all bad for exercise performance. But there are also other things that come with high altitude environments other than the decrease in atmospheric pressure and partial pressure of oxygen. I'm going to be talking about that in another video. Let's talk about some things about high altitude environments that are bad for exercise performance, or maybe just dangerous for your body or for your health, other than just the fact that you can't get as much oxygen floating around your bloodstream as you would like. So first one here is that the air temperature at altitude tends to be colder. For every 150 meters that you go up, you're going to expect about a 1 degree Celsius decrease in the air temperature. This increases the likelihood of cold injuries, things like frostbites, hypothermia, those sorts of things. Also, as you're going up and that air is getting colder, the cold air can hold less moisture. So if you look over here at this figure, we have temperatures on the x-axis, so going up in this direction, but if we go the other direction, going down, and then we have water vapor on the y-axis. So 100% humidity means the air is holding as much water as it can. 50% humidity, this orange line, is the air is holding half as much water as it can. So, but let's just look at the 100% humidity line. So at, say, 30 degrees Celsius, that is going to give you about 30 grams of water per kilogram of air. If you drop that in half to about 15 degrees Celsius, now you're down to about 10 grams of water. So dramatically less amounts of water per unit of air whenever the air gets colder. What's the problem with this? This cold, dry air at altitude is going to increase the risk of dehydration. You're going to have more water being essentially sucked out of your skin by the dry environment around you, and your respiratory fluid losses are going to be greater because you're breathing out humid air, but you're breathing in dry air. So you're going to be losing that fluid, that water in that process. Another thing that's going to happen at altitude is you're going to have an increase in your solar radiation due to that elevated altitude. This means sunburns, that sort of things are going to be more likely. So increased UV rays hitting your skin because you have less atmosphere above your head that's going to absorb some of that UV light. Also lower humidity for all the things I've mentioned up here, all the reasons I mentioned up here about the lower temperature. That is going to also affect the amount of solar radiation that reaches you, because water vapor, which is what humidity is one of the things that helps to absorb solar radiation and stop it from reaching your body and your skin, causing that damage from the sun on your skin. And another thing, most high altitude environments, if you go high enough at least, think like tops of mountains, they're going to have snow on the ground. Snow is white, it's reflective. So not only is the UV radiation coming down at you, now it's going up at you as well from the reflected UV light from the snow underneath of you. So it increases the amount of UV radiation that's going to be hitting your skin. I'm sure there's plenty of other things that are going to negatively affect your body because of the unique environment of high altitude. This was a short list of some major ones. Again, the big one though being the fact that the oxygen partial pressure is lower, but we talked about that a lot in other videos, so we focus on these ones here.